Good afternoon. We've had a couple of situations lately where only one member in a couple actually gets into recovery. And the question comes up, does that work? Is that okay? What happens? What's the likely outcome? We know that addiction, alcoholism, and drug addiction are family illnesses, so not only the person who has the addiction suffers, but the family suffers, sometimes even worse, frankly, because the person who's using the drugs often doesn't even know how much they're suffering, but the other person is worrying and angry and upset. And when the person goes to treatment and gets help and gets into sobriety, they feel a lot better, but often the family member doesn't feel that much better. They're still kind of angry. They still have a lot of behaviors and a lot of feelings that haven't been addressed. And that's why good treatment programs really focus on the family as well as the patient getting clean and sober. So the question then is, what happens if the other person doesn't participate in their own recovery? And there's sort of two options for that. One is the person's actively using drugs. We see that quite a lot. We had a couple this morning that both boyfriend and girlfriend were using heroin. And clearly if one of those gets clean and sober and the other one doesn't, then that's not going to work out well. But what if the other person doesn't actually use drugs and alcohol, but they've still been affected by the disease and they've still got some of the same behaviors? So early on I sort of heard it put this way: there's only a few outcomes that can happen if both people are in a family system have been affected, which is pretty much the case. One is that the person gets clean and sober and the other person doesn't. And that doesn't work out too well, because then you've got one person who's happy and working a program and doing well, but the other person who's still stuck in their old behaviors and is angry and has never forgiven and has never moved on with their life. So often that doesn't work out well. Sometimes the family member starts going to Al-Anon or gets some therapy and really starts improving, and the patient relapses, and that doesn't work out well. Sometimes they both relapse, the family member doesn't get any help and the patient relapses. Sometimes those couples stay together, but it isn't a good outcome because they're still stuck in poor behaviors and stuck in addiction. The fourth option is they both get better, but they look at each other after a while and go, you know what, I'm glad you're sober and clean and doing well, and I'm glad I'm happy and working on my stuff, but truthfully we met in dysfunction. We met, part of our dysfunction was to be attracted to each other, and so I love you, but we're really not good together. So they separate, and that's maybe not great, but it's actually not too bad, because then they're both happy and they can move on with their lives. The fifth option is that they both start working their program, they both get happy and healthy, and they look at each other and go, you know what, I loved you when we met, and we really are going to work on this together, and it really is a great outcome, because then they're talking the same language and they're both working on their problems together. So that's only one option out of 5, but it's open to everybody who wants it. So the bottom line is, both people in a couple should have to work on their program. They both have to grow emotionally. They both have to learn how to be happy and healthy for themselves while still loving and supporting the other person.